Here are the 4 areas that I would be paying attention to for 2025. Innovation value. I mean, look at Stargate. Look at what we're doing. We do a lot of work in the drug and life science area. They really are doing much better than we are in the medical device industry in terms of using AI to help us discover the next technology. And if you're not using AI to help you discover the next technology, you probably are putting yourself at risk because, the cool kids are. The other issue is that experiential value. We have the ability to significantly improve the experiences that we deliver for commercial clients and for patients by leveraging the thinking, learning machine. The other area that I'm really excited about is enterprise value. We know now that through robotic process automation, we can reduce costs by at least 30%. In our practical application of robotic process automation, we have clients that are saving 35 to 40% on their costs just by taking repetitive tasks and other tasks and letting the machine do it. In fact, the majority of us, we certainly see that in our practice, the majority of us will be hiring far more AI agents than people over the next 3 years. And the reason for that is that they're dutiful, they're specific, they're predictable, and they're a fraction of the cost. So I don't think we have much of a choice but to widely adopt the usage of these new agents to be able to do very, very specific things that we used to have humans do. And the good thing is that if we do this right, it actually improves the quality of life for everyone involved. I'll give you just a really quick example. When you think about it, when we started to use tractors in America, believe it or not, that was considered incredibly controversial. And the main reason that people pushed against the tractor on farms, we had 30 million farms at that time, was the fact that their expertise was animal husbandry. They were experts at animals, and they didn't want to learn the scary tractor. And those who didn't adopt the scary tractor by understanding carburetors and transmissions and how to manage this machine, those organizations, those farms, unfortunately went bankrupt. I mean, today in America, instead of 30 million farms, we have roughly 3 million farms. The ones that adopted essentially the robot, those farms thrived and prospered. And so it's easy, and then the interesting thing about it is that people were dying on the field from exhaustion, working 17-hour days, and then they turned it over to the robot, the tractor. And now they're working 8-hour days. So we can improve our quality of life. We can significantly improve productivity and yield so that we can allow the machine to do the lame machine stuff so that we can do the beautiful human stuff, which is important at a time of the human experience economy. I think lastly, of course, is clinical value. We see a lot of this right now, where we're able to do a much, much better job of improving the way in which we deliver clinical value. And again, the multimodal aspects of artificial intelligence, where we're looking at imagery, we're looking at disparate data sets, we're looking at all kinds of new things, those are going to drive far better innovations.